Good afternoon, and thank you to everyone for tuning in today. And I hope you've continued to follow public health recommendations over the weekend. A quick thank you for everyone who tuned in to our or submitted questions to our last week's COVID-19 town hall. Our next one will be on Thursday, October the 29th at 7 p.m. Thank you to Cable 14 and CHML for carrying the town hall events, and I'll look forward to answering more questions from our community, as I know Paul Johnson and Dr. Elizabeth will be as well. And we will apparently have some special guests joining us. In terms of updates, Halloween is coming, fast and furious, and I see lots of decorations out there already, which is terrific. And I know that today the province shared its guidelines for Halloween trick-or-treating. So while the province is recommending residents currently in stage 2 regions, not Hamilton, stage 2 regions, avoid trick-or-treating this year, Hamilton can continue with plans to trick-or-treat safely. So if you decide to trick-or-treat this year, please follow public health measures, including do not hand out candy or go trick-or-treating if you're feeling unwell or are self-isolating. Avoid coming into close contact with people who don't live in your household. Don't gather indoors or share food or treats, and always wear your mask if you're inside or can't keep your distance from others. And public health will be putting those recommendations on the hamilton.ca/coronavirus/celebrations during COVID-19 on our website. So you can go there to get all the regulations or rules around proper both handing out of Halloween treats and trick-or-treating this coming Halloween. So read them carefully and, please follow the advice of our public health. For those wishing to stay home and celebrate, there are many fun and safe ideas you can use or utilize to celebrate Halloween. And that includes hiding treats around the house and searching for them in the dark with a flashlight, decorating your home inside and out, and many people are already busy doing that. You could also have a contest with your neighbors for best decorated house. You could host a virtual Halloween party with friends and family, or you could have your kids show off their costumes and have a Monster Mash dance-a-thon virtually to celebrate that as well. So show off some of your Halloween crafts in the on the front porch, as you would the pumpkin or any other crafts that you would have, and try to bring that joy to yourself and your neighbors while you're at it. So what you shouldn't do is adults don't have that traditional Halloween party this year. There's no room for that. You can do it virtually. Dial in by Zoom with all of your friends and show off your costumes and share that with everybody, but don't have in-house parties with great gatherings. This is the wrong time to be doing that. Having said that, I'll pass it over to our Operations Center Director, Paul Johnson.
Thanks very much, Mr. Mayor. I'll be very brief today. Many of the things I talked about last week are the things that we're continuing to do at the Emergency Operations Center, monitor the situation. We're in constant contact with our local public health unit, who in turn is in contact with the province. So we're just trying to make sure that we're ready if anything changes provincially, and also just getting some further advice locally. And there have been a very few changes here in Hamilton because we have not been subject to some of the restrictions that are in the greater Toronto area in terms of York region and Peel region and the city of Toronto proper. So I think it is important for folks to recognize that there are differences that are happening now, and this is likely to be the way that things will work through the coming months, that there will be some things that are province-wide, absolutely, but there's also going to be some things that will be regionally or even city-specific. And so our website offers a great opportunity, hamilton.ca/coronavirus, for you to get all the latest information. It is updated regularly. The latest information is provided there. So if people have questions, and right now there is so much information you do need to go through. Someone asked me the other day, what is the gathering size limit? And unfortunately, there isn't even a single answer for that, because it does depend a little bit in terms of whether you are in a place of worship, which is at a percentage level, or a hall that's at a percentage level, or then some of the gatherings that individuals may have, which are at set number levels. So it's really important that you do some of the legwork if you're planning activities or looking around what the safe way to do activities, or even thinking to yourself, geez, I'm not sure that activity that I see online or that I was a part of might have been the right way to do it. And so it's always best to check that information. So our website provides a great opportunity for folks to get the latest information. It will continue to be updated as things change, and any of those particular notices that the mayor talked about in terms of any guidance that we have around future events, things like Halloween, will be up there as well. So continue to check the city's website. It is a great source of information. And we as the EOC ensure that the latest information we have gets posted there around city services. And I know that public health makes sure that it's updated with the latest guidance that they have as well. So with that, I'll pass it over to Dr. Richardson for our latest public health information.
Thanks very much, Paul, and well said. You know, it is a fairly complex situation in many ways, and so it's best to always go to the source and look at where things are at today around COVID-19 and what the control measures are, what the recommendations are. We are trying to keep them as simple and consistent as we can, but it's of course got wide-ranging impacts, and so it does bear checking it out and making sure you've got the most current information. So just in terms of COVID cases and trends, we're at 1,525 cases in total having been reported through this whole pandemic. That's 19 new cases from yesterday. Some good news that our average number of cases per day has actually dropped from 28 at the end of last week to 18 today because of some reduced numbers over the weekend. And so we're going to hope, fingers crossed, that that trend continues because of good work going on in this community to implement public health measures and reduce transmission. And so we'll keep watching that and reporting on that as we go forward. You will see on our website a total of 10 outbreaks posted there. We added 2 new ones today at the Cardinal Retirement Residence, as well as at Parkview Nursing Center. And of course, there's more details about those outbreaks and case statistics all on our website. Just a couple of things I want to highlight as we go forward. Given the increase in cases, we did add some control measures and that we asked people to do here in Hamilton. So we've sent a letter out to long-term care homes, retirement homes, residential care facilities, asking them to make sure they're in full compliance with the requirements under the province's Directive 3. It was updated at the end of last week, and given where we were at, we wanted to make sure that they really paid attention to ensuring there was active screening of staff, visitors, and residents, that there was appropriate and consistent use of universal masking and PPE, that absences were not permitted except for some limited compassionate reasons and medical reasons because of the risk of introducing infection into the facility, and similarly that the number and frequency of essential visitors be restricted as much as possible, and careful attention again paid to screening and use of PPE in those circumstances. So we've asked for similar measures at retirement homes and residential care facilities with some modifications, of course, as appropriate given the difference of the nature of those facilities versus long-term care. As well, given the discussions we've had around exercise classes, we've today issued some interim guidance for gyms. We have been discussing this issue with the province, and the public health measures table continues to look at the broader information they have available to them and the expertise that's gathered for them. And in the meantime, we have sent out a letter today to all recreational fitness facilities to modify the requirements that are set out in stage 3 by reminding them of a couple of things, but actually adding some new requirements. So the reminders are about making sure that the building heating, ventilation, air conditioning system, the HVAC system, is well maintained in accordance with the manufacturer's instructions, as well as meeting some guidelines that are put out there by HVAC experts, the ASHRAE standards. We're also asking them to ensure that no shouting or singing occurs in classes, and if they need to facilitate communication, that instead the instructors use a microphone to do that. As well, we've asked that physical distancing of at least 3 meters be maintained between every person in the facility while they are exercising, and ensuring that that is in place up from the 2 meters, and that we've set a capacity limit up to 10 persons, including staff, per indoor group fitness class or training session, where the final number, of course, is determined by them being able to practice that 3 meter rule. And finally, we're asking all persons to wear a face covering while they're in the facility, including when they're actively engaged in physical activity. So those are interim guidelines that we're issuing here, given what we've seen and in discussion with the province, and as they go through and do a broader review. And so we do anticipate that there will be some updated recommendations from the province shortly, but we felt it was important, given what we'd seen to date, to ask our gyms to make these changes. Once again, I do want to remind people, we continue to see with our cases that some people are not staying home if they're sick. They are not staying home even if they've gone for testing sometimes. Really, everybody, if you're not feeling it well at all, even if it's mild symptoms, you need to stay home until those either resolve or until you go for testing and get a result back from that testing. And very, very important in terms of limiting the spread of not only COVID-19, but it is a good general rule that we've been talking about for many, many years around any kind of infectious disease. So very important to do. And with that, Mr. Mayor, I'll hand it back to you.
Thank you very much, Dr. Elizabeth and Paul, for your continued good work and good advice. I just want to take a minute to do a bit of a shout out to gym owners and operators. I, like many, realize how important mental health is to physical health and physical health is to mental health. And so getting exercise is critically important. And, whatever way you do it, it's got to be done safely. You can certainly go outside and get exercise, but the gym operators and those that are working in the gyms actually are putting themselves pretty much on the front lines to try to do everything possible to allow people to get that exercise and at the same time do it safely. So the new advice is going to be very helpful. I would say the same about restaurants and restaurant workers and servers, that are continuously putting themselves on the front lines as well. We like to have our place to go and enjoy a meal, and someone has to cook it and someone has to bring it to us, and they have to interact with the public, virtually every day. And so, let's shout out to them for their good work and their willingness to continue to do that work on behalf of our community and ourselves. In fact, when we want to go out and enjoy a good meal somewhere else. And remember that you can order. Most restaurants are now virtually online, not virtually, but are online, and you can order from them at any time. It's something I do regularly now, and so that certainly helps keep the industry alive. And you can continue to support them by going to their online resources and ordering in whenever possible. And there's a GTHA campaign going on right now to encourage people to do just that, to ensure that we can continue to support our restaurant scene. There are, of course, a lot of other folks that are making sacrifices as well, including, our regular citizens out there that are, by and large, doing a great job of keeping the spread of the virus limited. And so we thank you for that effort. We know there's anxiety out there. But that anxiety has to be turned into action, and that action is some of the public health recommendations that you keep hearing from us and the doctor and Paul Johnson. As long as we continue to do that, we are going to be in much, much, much better shape. So thank you for all of your efforts, and I understand the frustrations, but now it's time to continue to bear down to ensure that we can contain this as much as humanly possible, hopefully until some virus at some point is available that will help us get back to some sense of normalcy. But as we all know, that is probably not in a couple of weeks or even in a couple of months. And so let's bear with it, and let's get to that point as safely as we can. I'm going to turn it over now to Jasmine for media questions. Thank you, Jasmine.
Thank you, Mr. Mayor. We have 7 media on the phone with us today, sorry. We'll start first with Bobby from CBC Hamilton. So Bobby, 1 question and 1 follow-up, and you can go ahead.
Thank you. I hope everyone's having a great day today. My first question, I guess, is for Dr. Richardson. The Cardinal Retirement Residence has its 2nd outbreak. We know it was hit hard in the first wave, and public health said that it developed training and protocols to stop the spread of the virus in retirement homes and long-term care homes. So with all that said, why are we seeing another case here, and what's the significance of another outbreak in the Cardinal?
Thanks very much, Bobby. And absolutely, we have done a lot of work with these facilities. The facilities themselves have done tons of work to get people trained and comfortable with the issues they're facing. Certainly in the first wave, the Cardinal was at the beginning of that first wave, and they were, needing to get up to speed in terms of IPAC, PPE, all the things that everybody was needing to do, but unfortunately they experienced cases early on as well. So this time around, absolutely, we're going to continue to see cases of COVID-19. They are going to happen in our schools. They're going to happen, unfortunately, in long-term care and retirement home facilities, because we're all out and interacting. And whatever we're doing in the community, we're going to see that reflected into the institutions in our community. So the more we can keep that case count down in the broader community, the more we'll see those case counts be down in those other institutions. So, we do remember that the definition of an outbreak for a long-term care facility or retirement home is a single case. So when we see that single case, it is a signal to remind everybody about the importance of those IPAC measures, the PPE use, all of those sorts of things, staying home if you're sick. And we're doing that. We work with the facility to make sure they've got all that on board as well. Our congregate settings table of the Hamilton COVID response table is going to be going through with each facility again to look at what are their needs. There have been several surveys that have been done over this past couple of months by Ontario Health to look at what are their needs, what do they need help with, and we're helping everybody with those. So we're definitely working with these organizations, and we think we're farther ahead, but there's no doubt systematically that there's probably some other things, as you're hearing from the commission that the province has struck, that needs to be done on a wider basis. So not surprised that we have a single case. We're working with them, and we really need to keep those cases down more broadly so that we can protect all of these such institutions.
Thank you. And my second question, also for you, Dr. Richardson. The new daily case average, which was, I guess, earlier this morning, we were talking about how it was something like 27 or 28. And now over the past few days, we've seen that number lower. And there was also talk of, hopefully not seeing a fall peak. So I just wonder, where are the numbers going to be going? Did the SPINCO outbreak happen to kind of inflate the amount of numbers that we've seen in the past few days? I just wonder, it's just going up and down,
Sure. Thanks, Bobby. And it's challenging too. The Board of Health, we did all of our presentations this morning based on Friday's data. And then by sort of almost the end of the Board of Health, we have our updated stats and analysis from our epidemiologists. And so I can appreciate, the numbers change. It can be kind of challenging to watch them. So the good news is, as you said, the number came down from 28 on Friday to 18 today in terms of average number of cases per day. We did see lower numbers over the weekend. There's a couple of things that I think have contributed to the rise. One is truly we see more transmission in the community. There's no doubt of that. As well, we know we had a backlog in terms of people being able to get in for testing when they were sick, and then those test results getting through to us. And I'm pleased to say that for many of those now, those numbers are right down. People are getting in quickly, and the tests are getting done more quickly and coming through to us. So I think that's part of it, is there was a bit of a bottleneck, if you were, and an increase in that way. But, as I said, most importantly is this piece about we do see some ongoing transmission. We are seeing people who aren't using public health measures, and that tends to be where that actually does happen. The SPINCO outbreak, would have had an impact as well in terms of our numbers and the number of cases resulting from that. But by no means is that the sole issue. That kind of transmission is going on in these other settings in other ways. So while SPINCO has been a vehicle for us to talk about the importance of these and for us to see the importance of what can happen, it by no means is the only thing that's going on related to transmission here. So I just want to address the one other comment you made about the second peak and will there be one? I think we're going to have a second peak. The issue is just how big is that peak going to be? And we want to bring that peak down, keep it down, and not end up either at a higher plateau or have it continue to rise. So
Thank you.
Great. Thank you, Dr. Richardson. Next question will be to Kate McCullough from the Hamilton Spectator. So Kate, you can go ahead.
Hi, everyone. Thanks for taking my question today. My question is also for Dr. Richardson. I wanted to ask for a little bit of clarification around Halloween. We've been hearing from parents, from Hamilton parents and guardians, that they're not sure whether or not they're allowed to take their kids trick-or-treating. I know the province said today areas in stage 2 should avoid it, but will Hamilton Public Health issue its own directive or any more specific recommendation locally on whether or not we should be trick-or-treating this year?
Hi, Kate. I think the mayor said it really well about not canceling Halloween. We're not there. there to do that, but we do have some guidance for people. We're not in the same situation that Toronto, Ottawa, Peel, York are in, which is good news. So we're not saying that people absolutely should not go out and trick or treat. We are saying people should not be having, parties. We're recommending that they celebrate in alternate ways. But if people choose to do the trick or treating piece, we would suggest that there's a number of ways that that could be done more safely. And you'll see all of that information on our website. So sometimes it's easier to have an answer that's yes or no. And ours is a little bit more sort of, you're better off to stay home. You're better off to do things that do not involve going out. But if you do choose to do that, whether you're somebody who's opening up their house that way in terms of providing candy, or if you're somebody who is deciding to go out trick-or-treating or to have some sort of celebration, there's lots of safer ways to do that. And you can find lots of recommendations about that on our website.
Great, thanks very much. My second question is there a concern that, as we've seen with gyms and other sectors, that there will be an influx of folks coming from hot zones like Toronto and Peel traveling to Hamilton to trick or treat, especially given that this is on a Saturday this year and folks might have a little bit more time than they would in after school hours?
Yeah, thanks, Kate. I think, the influx issue is one that we're concerned about, not just for trick-or-treating, but in all sorts of ways. And so, that is a piece where we're definitely asking people to be following the directions that are relevant for the zone that they live in. So if you're in Toronto, Peel, Ottawa, York, please, stay in your areas and follow the recommendations that are outlined for your area, rather than travel to somewhere else to get out to a restaurant or to go out and do trick-or-treating, those sorts of things. I mean, that really does just set aside the objectives we're trying to meet by limiting spread. So I haven't heard anything particular in terms of concerns that way for our region, but have heard them to some extent for those that are closer to Toronto. And so would just very much be encouraging people to follow the advice that's relevant for the zone that they live in.
Thanks very much.
Thanks, Dr. Richardson. Next question will be to Lisa Pileski from CHML. So Lisa, you can go ahead.
Hi, thanks very much. One of my questions was already asked, so I just have the one for Paul Johnson. Basically, just following up on the clearing of the encampments. That work was done over the weekend and on Friday. Just wondering if you could talk a little bit about how that process went and whether or not everyone who needed to get shelter was able to be put into shelter. We just heard from some local advocates that they had concerns about how the process went. So I just wanted to hear from you.
Sure, thanks very much for the question. We were really pleased to work with a number of partners, and everybody's focusing on Thursday and Friday last week, but in fact, this work began almost 2 weeks prior to that, and communication and intensive work was happening for the 7 days prior to it to make sure people were aware. So there was a full week of notice, actually handed out notices by Keeping Six and HamSmart, and as well as our outreach folks, recognizing that we didn't want people to wake up on a Thursday and realize that something was happening. So there was plenty of notice done. And then on Thursday and Friday, vast majority of people were wanting to get into or willing to go to shelters and hotels, and that happened. We had large numbers. Some people chose not to engage or chose to do other things, and that's their right, of course, as well. But for those who wanted to go to a shelter or hotel and were willing to do that, we had spaces available for them on those days, and continue to expand our spaces. More spaces became available for women today, and continue to look at, we will do everything it takes to make sure that there are the right number of shelter spaces or hotel spaces available through this crisis, while we also look at the ways that we can work with folks around affordable housing. But it was more than that. Teams of folks from our social navigator program, both the police side and the paramedic side, our public works staff were on hand to assist with cleanup. We had people transporting belongings of individuals to different places, or with them to the shelter that they were going to, or the hotel that they were going to, and it was really great to have that recognized, just the way that the city staff team worked together, and also changed on the fly. We're working with people, and we know these folks well. Our outreach team does, and so as things needed to be adjusted and changed on the fly, we did so, and it was really appreciative of the note from Dr. Jill, who just recognized that, and recognized it was a whole team effort, and she thought it was done in a very good way, and we had worked with HamSmart and Keeping Six to make sure that it was so. So this isn't homelessness is not something we want to keep going, and obviously shelters and hotels are still really pretty close to the street, and we want to get people into permanent housing and supportive housing. But the reality is we had so many people sleeping rough in the community that this was going to be a major effort over a couple of days, and it'll continue to be an effort over the coming weeks. We don't stop our engagement after Thursday and Friday. We continue to engage. There are folks who we need to work with on a longer term basis in terms of where the best place for them to go is. And then we need to keep doing the great work we're doing in terms of permanent affordable housing options. And we've had plenty of those successes through this pandemic and prior to the pandemic. So in terms of, I don't want to make it sound like this was some great event, because it's homelessness. Our answers to homelessness certainly are not encampments, but they're also not shelters and hotels. Our answers to homelessness are housing with the appropriate supports. And so we've taken some steps to get people into safer places and places where they can stabilize and get ready for those next steps. But we haven't solved homelessness with what's been happening in the last few days and over the last few months. We're taking those steps to continue to do what we can to solve this issue.
Thank you very much. And that's my only question.
Great, thank you. Next question will be to Katrina Clark from the Hamilton Spectator. So Katrina, you can go ahead.
Thanks for taking my questions. This question is for Dr. Richardson. Regarding the chart that was presented at the Board of Health today, showing all the links to the primary cases in the SPINCO outbreak, but not necessarily spread, I'm wondering what that tells you about how big the spread potentially could have been. And I'm also wondering if you can say how many of those settings actually did see cases linked to the SPINCO outbreak.
Thanks, Katrina. So just trying to understand your question a little bit. I mean, all of the information we presented represented where we saw cases that were linked. So that was what was in that diagram that you're referring to. In terms of how big the spread could have been. Mackenzie talked earlier about during that session about the fact that about 25% of the cases overall were what we saw early on in this pandemic in terms of what proportion were actually reported back to us, tested, reported back to public health. And we're not sure where that number sits now. We think with the increasing volume of testing that's available and the reach of testing that has been done, that number's probably come down, but we can't say for sure. And so, really this was an opportunity to give an example of what does happen with COVID-19, how it does spread from one place to another, and why it is so very important that people are following public health measures. They're wearing their masks, they're maintaining physical distancing, they are staying home if they're sick because of the fact that it has the potential to spread.
Thank you. Maybe I misunderstood part of the presentation, because my understanding was that those 51 settings that were linked to SPINCO, there weren't necessarily cases in each of those settings, but were there cases in each of those settings?
So if you go back to the graphic and look at it, you'll see that there's the original site where the primary cases occurred, and then there are a number of other settings. And so the total number of other settings will be higher than the number of cases, because, if you take an individual as an example, they may have gone to an exercise class in one place, but they work somewhere else and they live somewhere else. And so there's 3 potential settings that they could be linked to. So that might be where part of the confusion is coming up. Essentially, it is all of those kinds of settings, all of those number of settings that Mackenzie laid out, that there were cases. They may have been primary cases. And in some of those settings, we also saw secondary cases.
Great, thank you, Dr. Richardson. Next question is to Linny Lambrink from CBC London. So you can go ahead. Are you there, Linny?
Can you hear me now?
Yep, go ahead.
Okay. I was talking for a while there, so I don't know how long I was out. But so this is a question for Paul Johnson, and it's also about the Ferguson encampment. And I was hoping for some more numbers. Are you able to say how many people were in the encampment, how many were sheltered, and how many decided to move to other green spaces?
So no, our staff are pulling those numbers together. We won't know where everybody went because some people didn't choose to engage and made their own decisions. But we do know that quite a number of folks ended up in shelters and hotels, and so our staff are working at pulling those numbers together where we can understand where people went. But as I say, we may not be able to provide a count or a direction for every single person. Because some made their own choices, and that's their right to do so.
Would you have like a ballpark of the number of people who were living there before Thursday?
Yeah, there were in and around 60 people or so living in the encampment was the latest numbers that I heard. It fluctuated a little bit. We did know that there were some tents that were actually empty. So there were tents there. So there might have been more tents on the street. At one point there were 70 tents, but there wasn't, some of the tents had been abandoned already. And as I said, we had been working on this in terms of communication and work with people to actually move them out of the encampment. That work actually began on September 30th, October 1st, once the agreement was ratified by council, we actually started to work with folks. And then that following Tuesday, when the injunction was actually lifted, some formal communication was happening. So again, from the encampment, we had people moving into shelters, hotels, and I believe even a couple moving into permanent housing prior to last Thursday and Friday. So I know that there's a desire to understand what happened Thursday and Friday, but there were people moving into shelters, hotels, and housing prior to that as well. So at Ferguson, there were about 60. I believe there were about 7 or 8 at First Ontario Centre, which were 2 of the primary areas we were looking at. And we were down to only 1 or 2 people at Whitehorn, which was another area of concern given the heritage nature of that building. So those were our 3 priority areas, Thursday, Friday of last week. The largest, of course, was Ferguson Avenue. So in total, you probably were looking at close to 70 people in those 3 locations.
Okay, thank you. Would you be able to say, like, just give me kind of a rough sense of how many people did go into a shelter and how many people moved along? Like, I know that these things fluctuate, but I'm just trying to get a sense of how many people were like, yep, I'll go somewhere indoors, and how many people decided to.
Well, the majority of the people we engaged were interested in their options in terms of shelters and hotels. And so that movement was the majority. We'll get the final numbers, but we're not looking at here where that was the minority of people that were moving on and the majority have stayed outside, because the reality is for those who are not high acuity, staying outside is you know, again, not an option. That it's just a matter of finding a new location for long periods of time. We're going to continue to engage, and you know, people were interested, very interested in many of the options that we were providing to folks. And I think that there have been over the time, you know, some myths that, you know, couples couldn't stay together. And so therefore some couples that were on the street were very worried about that, rightly so. And that's not the case. We have housing options and shelter options that in our hotels that allow couples to stay together. And so that those things sort of take the anxiety down a little bit. And so there's been some good work that's happened. As I say, since September 30th, when this was ratified by council and agreed to by the parties. And I was quite pleased to hear how many people were taking us up on those options. We increased the number of hotel spaces, and those were utilized. And we've increased the number of hotel spaces, particularly for women and couples, again today. So that's a sign that obviously people are accessing those programs.
Great, thank you, Paul. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions today. My questions are for Dr. Richardson. At Board of Health, you said that you track the broad sort of consequences of public health measures such as mental health. Can you let me know, like, what has that tracking found so far?
Thanks, Joanna. Yes, we're tracking a number of indicators along with the city EOC. So we have some numbers that come out of police and out of EMS and others. So it's allowing us to look at things like the number of emergency department visits for overdoses and for some mental health conditions, domestic violence, those sorts of issues. So early on in the pandemic, we did see an increase in some of the domestic violence statistics, but those actually came right back down. And since then, most of the stats have been sitting either below or at the same level that they normally trend at. So we follow them closely. The exception was, I believe it was last week, that there was a spike in the overdose numbers. And so we did send out a notice, as we have done in the past, to the partner agencies. We sent out a notice to our healthcare partners that we were seeing this spike in overdoses. And we also get some qualitative information, some insight into whether there's any new drugs or that sort of thing that we share along with that. So those have been the two sort of main issues that we've seen as we've gone through.
Okay, thanks so much. And again, at Board of Health, we heard that the socioeconomic report, the social determinants of health report, only reflects those tested and had a low rate of response from some groups. Would the groups, would that sort of low rate of testing and low rate of response from some groups, would that be the same groups most likely to be disproportionately affected so that the situation could actually be worse than the report? Or, what do you think that means for the report?
Yeah, it's definitely a challenge when we're doing that sort of work. I mean, when we're talking about health equity issues and social determinants, it can be very much the access to testing that is part of the challenge. And so we don't get anything reported from those groups. The good news is that in concert with Paul and the EOC and the housing colleagues, we have, and HamSmart as well, we have been out there testing individuals in some of those higher risk communities like the shelters. We've also been offering mobile testing so that we can ensure those that have a difficult time getting to an assessment center can get tested. So we've been trying as much as we can to try and increase the availability and accessibility of testing so that people can get tested. So we hope that's making up for some of that challenge in access. In terms of the response rates, that is one of the challenges. We know this is very much a delicate area. It's kind of new for many people for us to be asking these kinds of questions when we're collecting this kind of information. And so we can understand that people are just getting used to it. Our staff are well trained in order to do that and help people feel comfortable. But I think over time, that comfort is likely to increase as this becomes more clear about the reasons why we're doing it, and that we're doing it to help those groups to understand what their challenges are and how we can help them.
Thanks, Dr. Richardson. Mr. Mayor, with that's the end of our media questions. So I'll pass it back to you for some closing remarks.
All right, thank you very much, and thank you, the media, for your questions, and thank you, Doctor and Paul, for your answers. I'd like to thank the entire team at Cable 14, including Bill Custers, for their ongoing work to bring these broadcasts to you, and continue to remind you that our public health measures are, and the request is that if you're sick, stay home, keep your distance from people you don't live with, wear a mask indoors or when maintaining physical distance is a challenge, and keep washing your hands as often as you can, and keep wiping down those touch surfaces that could potentially spread the coronavirus. And, for a reminder as well that now's the time to book your flu shot. We want to make sure that people are covered on the flu side as well as preventing the spread of the coronavirus. And lastly, let me just thank the administrators and teachers in our schools right now. You know what, the whole school year started with a whole lot of anxiety and worry about how is this all going to work out and how are the kids going to manage. And I must say that teachers have done a terrific job. The administrators have done a great job. The facility cleaners and folks that have set up the schools have done a great job. And by and large, it's working out pretty darn well compared to what most people thought was going to happen. So congratulations. And, the teachers every day are dealing with a classroom full of kids that, want to learn and want to be socialized and want to stay engaged. It's so important for them to do. And the teachers are helping to facilitate that. So God bless you for your work, and continued good work into the future. Our next media briefing will be on Monday, October the 26th at 4 p.m. Talk to you then.